Addiction to opioids, pain-killing drugs, remains a critical problem across the country, and particularly, it seems, right here in our own region. Connecting Point correspondent Carolee McGrath spoke with Dr. Robert Roose, Chief Medical Officer and Vice President of Addiction and Recovery Services for Mercy Medical Center, to get an update on the continuing critical battle against opioid addiction.
As you might remember, Governor Baker and Attorney General Maura Healey announced the opioid crisis as one of their top priorities back upon inauguration into office. The 16-member opioid working group was formed at the beginning of 2015, and we pulled together a set of 65 recommendations that focused on prevention, intervention, treatment, and recovery for those suffering from substance use disorders. Those recommendations were presented to the governor of the administration in June of 2015, and very pleased, and I think it goes due to be noted that at this point, as of September in 2016, 93% of those recommendations have either been enacted and completed or are currently in progress. So there's been great strides made amongst all four of those domains to address this deadly crisis.
And one of those that was enacted was the 7-day limit on opioid prescriptions. How important was that for you?
Yeah, I think that is certainly one of the ways in which we've looked to prevent further individuals from developing opiate addiction, was look at how we can reduce access and overprescribing of prescription painkillers. We know that now most people that are seeking treatment for heroin addiction in the Commonwealth of Massachusetts, in our region and across the country, first started with exposure to opiates from a painkiller. And so it's really important, as we looked to how do we reduce that supply and how do we prevent further individuals from developing problems, to look at how much we are prescribing, to focus on limits potentially for certain types of procedures or in certain instances, but also with that, a development of enhanced education of providers from all levels, from students all the way up to practicing physicians and other practitioners. And so that was, I think, an important step, but part of a much larger package of how we can address this.
Now, I know there's been a tremendous amount of focus, including the group, on the crisis in Massachusetts, but according to state statistics, the numbers are still up as far as opioid overdose deaths from January 2016 to June. How do you combat that going forward?
Right. So you're correct in noting that opiate overdose deaths has continued to rise from 2013 up until the data that we have so far in 2016. What I think is important to recognize with that is that the framework and the initiatives that are being implemented to address this crisis are setting the stage to start to bend that trend in the coming years. There have been some things that have occurred over the last year that have continued to present challenges. For example, what we know now, based on the data, is that the vast majority of individuals that die of an opiate overdose, it's involving heroin and it's also involving fentanyl. And fentanyl is a newer, more powerful, more potent synthetic opiate that presents even greater risk for death if it is used accidentally or intentionally by somebody who is suffering from opiate addiction.
So how do you combat that? Obviously, law enforcement has to be part of that equation as well. But I mean, is it more education for kids before they even get to that level?
Yeah, I think it's a multi-pronged approach, just like it is when we are looking to address heroin addiction. Fentanyl is often being adulterated or mixed into what is presumed to be heroin, and therefore carries a much stronger potency for individuals who are not aware of it. So one way that we can combat it is continuing to increase access to the opioid overdose reversal drug Narcan, and providing better access with higher dosages and with new formulations. And in the past year, both of those have occurred. And so that there's been a new formulation of Narcan that is easier to use and can be delivered at higher dosages that may be more effective at reversing opiate overdose from somebody who may have inadvertently used fentanyl.
So obviously this is not just a problem that affects the inner city, it's definitely made its way to the suburbs. How do you get the message out to teens in particular? I've heard stories of farm parties where kids will come and dump in pills in a bowl, and then use that as opposed to maybe perhaps the old days, whether it was alcohol or something else. How do you get the message out to them not to go down that road?
Yeah, I think if we're going to make any headway into this disease, which we know is a community disease, we need to start looking a couple of generations ahead. and how can we really prevent this, and start to change the culture around experimentation with substances, quick fixes, ways in which perhaps as a society we don't cope with problems and concerns as well as we could, and start to kind of change that conversation at a very, very early age. The good news is that there is some evidence to suggest that prevention programs at young ages can be very effective in reducing problematic substance use. And those programs, what they tend to do is highlight at-risk individuals who may suffer from anxiety, impulsiveness, or have that maybe extra sensation that they want to seek something outside of themselves. And if we can focus resiliency training and improved coping skills around those individuals and provide opportunities for our youth, then I think we will see much more success with prevention down the line. Specifically around opiates, one of the problems and one of the reasons why it became such a concern is that, medications are something that came from the medical community. And there's there was an understanding that these medications, just like other medications, are relatively safe and relatively harmless. And the perception of harm that teenagers or young people have around the use of something is very important. And so if that perception that it's harmful or risky is low, it's going to increase the risk that somebody's going to try it and use it. Well, now we know that that's not true, particularly in the case of prescription painkillers. And I think that the message has started to shift so that our community has recognized that, and families and young people have recognized that or are starting to recognize that. But what concerns me about that is, are we doing the same thing again potentially with other substances? And as perception of harm might go down, the use might go up. And so we need to look at what is the next potential risk for young people coming down the line.
I know that you see patients day to day, and there are great success stories where there's a light at the end of the tunnel. Can you talk about that?
Absolutely. And I appreciate the question, because that's something that often doesn't get told when thinking about addiction treatment. Addiction is a chronic disease. It's a chronic disease of the brain that impacts one's biology, one's psychology, and their social environment. But what we know to be true is that treatment works. And when we use treatment that's evidence-based, particularly for opiate addiction, we see great success stories. Just like any other chronic disease, like asthma or diabetes, when somebody continues to receive treatment and is able to adhere to that treatment, we see about 80% of patients doing very well. And those are the stories that aren't often told. So in my office, when I see patients in long-term recovery, they're going back to work. They're your colleagues, perhaps, in schools. They're the ones that are perhaps checking you out at the register, or you might never, ever realize that they once struggled with addiction, because those are the anonymous stories that often don't get told, because you would never know when somebody's doing well. You tend to just realize when somebody's not doing well, and their behaviors may change. And so across the country, more than 25 million people live in long-term recovery. And it's those stories that I get to see every day that makes this field so rewarding. And I recognize every day that we're all part of the same community. And if we focus on this in the right way, we'll make a huge difference for ourselves and our society.
Dr. Roose, thank you so much for joining us, and thank you also for all of the work that you have done on this issue.
Thank you.